Reproductive life planning includes all the decisions an individual or couple make about whether and when to have a children, how many to have, and how they are spaced. A number of 2020 national health goals speak directly to reproductive life planning are: increase the proportion of adolescents who receive formal instruction on abstinence before 18 years of age from a baseline of 87.2% to a target of 95.9%. Increase the proportion of adolescents who receive formal instruction on abstinence before 18 years of age from a baseline of 87.2% to a target of 95%. Reduce the proportion of females experiencing pregnancy despite use of a reversible contraceptive method from a baseline of 12.4% to a target of 9.9%. Lastly, increase the proportion of intended pregnancies from a baseline of 51% to a target of 56%. Next slide, we have a number of 2020 national health goals speak directly to reproductive life planning. Decrease the proportion of births occurring within 18 months of a previous birth from a baseline of 35.3% to a target of 31.7% according to U.S. Department of Health and Human Services (DHHS). On the other hand, nurses can help the nation achieve these objectives by teaching people, especially adolescents, about contraceptive options while being cautious to avoid directly encouraging sexual activity among teens.
Assessment.
As a result of changing social values and lifestyles, many people today are able to talk easily about reproductive life planning. Other people, however, may be uncomfortable with this topic and may not voice their interest in the subject independently. At health assessments, ask the clients if they want more information or need any help with reproductive life planning as part of obtaining a basic health history. Nursing diagnosis.
Because reproductive life planning touches so many facets of life, nursing diagnosis can differ greatly depending on the circumstances and individual preferences.
Decisional conflict related to unintended pregnancy. Powerless related to failure of chosen contraceptive. Altered sexuality pattern related to fear of pregnancy. Risk of ineffective health maintenance related to lack of knowledge about natural family planning methods. Planning and implementation. These are the expected outcomes for care in this area. Be certain plans are realistic for each couple. If a woman has a history of poor compliance with medication, for instance, it might not be realistic for her to plan on taking an oral contraceptive every day. It is equally important to explore your own beliefs and values before counseling. This not only helps develop self-awareness of how these beliefs affect nursing care, but it also allows you to become more sensitive to the beliefs of others. Outcome and evaluation. Evaluation is important in reproductive life planning, because anything that causes clients to discontinue or misuse a particular method will leave them at risk of pregnancy. Evaluate not only whether a chosen method is effective but also whether the woman and her partner are satisfied or have further questions. Examples of expected outcomes include: client voice confidence in chosen contraceptive method by next visit. Client expresses satisfaction with chosen method at follow-up visit. Client consistently uses chosen method without pregnancy for 1 year's time.
Contraception is by using of drugs, devices of surgery to prevent pregnancy. As many as 93% of women of childbearing age in the United States use some form of contraception. Major benefits of this is increase in contraception include decreases in unattended adolescents' pregnancies, the need for morning and after, or postcoital medication, and elective terminations of pregnancy. Important things to consider when helping a couple choose a method that will be right for them include personal values, ability to use a method correctly, if the method will affect sexual enjoyment, financial factors, if a couple's relationship is short-term or long-term, prior experiences with contraception, future plans. Ideal contraceptive should be safe, effective, compatible with religious and cultural beliefs and personal preferences of both the user and sexual partner, free of bothersome side effects, convenient to use and easily obtainable, affordable and needing few instructions to effective use, free of effects after discontinuation on future pregnancies. Before a patient begins a new method of contraception, information that should be obtained include vital sign, obstetric history, including STI, subjective assessment of the client's desire, needs or feelings, and sexual practices such as frequency, number of partners, feeling about sex, and body image.
Family planning. Family planning methods, also called periodic abstinence methods, are, as the name implies, methods that involve no introduction of chemical foreign material into the body. Abstinence. Abstinence, or refraining from sexual relationship, has a theoretical 0% failure rate and is also the most effective way to prevent STIs. Clients, however, particularly adolescents, may find it difficult to adhere to abstinence because of peer pressure. In a moment of passion, many otherwise responsible people may completely overlook abstinence as an option. Because it is difficult for many women to adhere to abstinence, the method has a failure rate as high as 85%. Lactation amenorrhea method. As long as a woman is breastfeeding, there is both natural suppression of ovulation and return of menses. Lactation amenorrhea method is a safe birth control method. If an infant is under 6 months of age, being totally breastfed at least every 4 hours during the day and every 6 hours at night, receives no supplementary feedings, and menses has not returned. Coitus interruptus. Coitus interruptus, or withdrawal, is one of the oldest known methods of contraception. The couple proceed with coitus until the moment of ejaculation. Then the man withdraws and spermatozoa are emitted outside the vagina.
Fertile awareness methods rely on detecting when a woman will be capable of impregnation or fertile, so she can use periods of abstinence during that time. Calendar or rhythm method. The calendar method requires a couple to abstain from coitus on the days of a menstrual cycle, when the woman is most likely to conceive. To plan for this, the woman keeps a diary of about 6 menstrual cycles. To calculate safe days of these substances, 18 from the shortest cycle to documented. This number predicts her first fertile day.
Basal body temperature method. Just before the day of ovulation, a woman's basal body temperature, BBT, or the temperature of her body at rest, falls about 0.5 Fahrenheit at the time of ovulation. Her BBT rises a full Fahrenheit degree, 0.2 degrees Celsius, because of the rise in progesterone with ovulation. These patterns serve as the basis for the BBT method of contraception. To use this method, the woman takes her temperature either orally or with a tympanic thermometer each morning immediately after waking before she rises from bed or undertakes any activity. This is her BBT. A woman who works nights should take her temperature after awakening from her longer sleep period, no matter what the time of day.
Cervical mucus method. 2-day method. To use a 2-day method, a woman assesses for vaginal secretions daily. If she feels secretions for 2 days in a row, she avoids coitus that day, and the day following as the presence of secretions suggests fertility. The method requires conscientious daily assessment and results in about 12 days per month in which she should avoid coitus, the same as a calendar method. Ovulation detection.
Still another method to predict ovulation is by the use of an over-the-counter ovulation detection kit. These kits detect the mid-cycle surge of luteinizing hormone, LH, that can be detected in urine 12 to 24 hours before ovulation. Such kits 98% to 100% accurate in predicting ovulation.
Side effects and contraindications for natural family planning.